Vasectomy is when you remove or you obstruct the progress of the sperm from the testicles. And the vas is how the sperm comes from the testicles and in the ejaculate, and then is used to fertilize the female. And vasectomy prevents that from happening. It's a lifestyle choice, and a couple or a man alone can indeed decide that they don't wish to have any more or any children, and then they can have a vasectomy, and this will stop them releasing sperm. Well, I think that you should always keep your options open. So I would say somebody who has children rather than somebody who doesn't have children, possibly in a stable relationship, but that is not necessarily the case. And somebody who no longer has any desire to have any more children. Those are the ideal candidates for me. Usually they should have a partner who is still fertile. So if your partner isn't fertile, then there's no point in having a vasectomy. Yes, there are lots of risks associated with any type of surgery. In particular, with vasectomy, there's a risk of infection, bleeding, and pain. In some men, the risk of pain can be chronic in 2.5% of men. A small percentage of men will fail. 1 in 500 will fail immediately, 1 in 2,500 later. And 2.5% of men will continue to produce dead sperm for up to 3 years. And 2.5% of men may have a cyst spermatocele after a vasectomy. So I always advise patients to have some Nurofen and paracetamol at home, to bring some Speedos to wear immediately afterwards, and their partner should not have their best cotton sheets on the bed because there can be some bleeding. Also, as it's any procedure, they shouldn't be doing some important events afterwards like riding or cycling or doing a business deal, because all of that can be impacted if you're having some discomfort. The recovery time varies from patient to patient. Some patients recover within 48 to 72 hours, others need longer. If you have a complication such as an infection or hematoma, then it can take even longer. But you cannot use vasectomy as a form of contraception until you've done a semen analysis, usually at week 14, and that shows no sperm.